Hey guys, what's up? It's me, Bree, aka Beautiful Reason. Today is August 29th, 2012, and this is the day after my HSG. I actually recorded footage from my HSG yesterday, but it's on my phone and I can't find my USB, and I know a lot of you guys have been waiting for an update. So I'm just gonna give you guys a quick update and I'll probably upload that other footage later when I find my USB cord. Anyway, so yesterday I got my HSG done around 2 o'clock. They told me to be there at 1:30. I got there about 1:15. I went to registration. They had me go to one room. It was room 101. And then I had to go across from there to room 107 after I finished my registration. So basically, I went in registration and they just asked me my name and asked me for my insurance. I informed them that I was going to be paying cash, and it cost me $225 to get my HSG test done. That price varies from place to place. I found a place that wanted to charge $1,000. So I find that $225 is a good deal. Anyway, so I got there, did the registration, went to the other room. I gave them the papers at the diagnostic center that the place from registration gave me. Basically, it was letting them know that I was there for an HSG, that I paid my money, and everything like that. So after I did that, it had me wait, and I waited until I got there at like 1:33. I got into the other room at like 1:33 p.m. and they called me at like 1:44 to go back for my HSG. So as we were walking back, the lady was like, "How are you?" And I'm like, "I'm nervous." I was like, "I watched too many videos on YouTube." And she was like, "Oh, you weren't supposed to do that." And I'm like, "I couldn't help it," or whatnot. And she was like, "It's okay. The doctor is very good and we're going to take care of you." She was very reassuring and comforting. And I like that. And so I got back there and they showed me the bathroom. They told me to get dressed from the waist down. Gave me some socks that I love. I love hospital socks. And they told me they left a panty liner in there for me for after I'm done with the procedure and some stuff to clean up with. So anyway, I did that. I came out and they told me to get on the table. And they had this little tray with everything. And she was like, after I set everything up, I'm going to explain to you what it is. And I let her know that I knew. Sorry about that. I let her know that I knew what everything was because I have done a lot of research and I've been wanting to get this done for quite some time now, but I was just nervous. So anyway, she still explained to me everything, and then she had another girl in there with her who was a student, and she was learning the procedure and things like that. So another woman came in that was going to help. She was a tech also. She was going to help the doctor with things, hand things off to him. Sorry if I'm talking fast, you guys. I'm trying to do this video quick. So the doctor came in and he was like, "Hey, we all just talked." I mean, we were having like a good conversation. And he was like, "Hey, did they explain the procedure?" And the nurse was like, "No, she explained the procedure to us." And I was like, "Yeah." And he was like, "Really?" And I was like, "Yeah, I did research, things like that." And he just kept explaining things to me, instruments and everything like that, to make sure I was comfortable and we could continue to talk. So one of the older ladies told me to lay down and scoot to the edge of the table, scoot my butt to the edge of the table. And when I tell you, they had me wide open, it was like they can see up my rectum. I was so wide open. I know that's TMI, but it was the truth. The doctor sat down in his chair. The office, it was like a regular doctor's office, kind of, except with an x-ray machine over you. And I'm glad it wasn't like an operating room type setting. It was just like a regular doctor's room type setting. Anyway, so he put the spectrum in. It was a clear disposable spectrum. He put that in and he looked at my cervix, and my cervix was kind of wonky. It was like off to the side. And he was like, I'm not sure if I'm going to be able to get it in, but he did. He took these little clamps. They look like scissors like this, but they're not sharp or anything. And he opened my cervix more with that. He inserted the catheter. I didn't even feel him putting the catheter in. I was scared about the catheter. I was scared about the balloon. But I didn't feel him inflate the balloon. I didn't feel him put the catheter in. And then he was like, oh, I'm going to remove the spectrum now. So he removed the spectrum, and the catheter was in. So he told me to hold the syringe part where they had the dye. He was like, hold that for a second. He placed it across my chest. And then he told me to scoot up and relax and put my legs down. So I did that, and the older lady came and held my hand, and she was talking to me because I was just so nervous. And when he started putting the dye through, I started to feel like my stomach was bloating. It didn't hurt though. It felt like gas pain, like regular pains if you have gas, but it wasn't nothing like I was going to cry or anything. So after he did that, let me check my time really quick. Oh my God, I'm talking so long. After he did that, he put the dye through, and you can see it going through, and it didn't move. It didn't go anywhere. It just sat in my uterus, and then he tilted me over to the left. Mind you that my left tube is blocked. That's what my doctors told me 4 years ago. He turned me to my left, and the dye flowed out my left tube, and I'm like, oh my God. And he was like, your left tube is clear. So he turned me to the right, and the right tube did not flush, and that's the tube I had my ectopic pregnancy in. And he flushed it again with more dye, and the dye went through. So both of my tubes are clear, and I'm kind of excited. It's kind of bittersweet because now I feel like, okay, my blood work is saying that I don't have polycystic ovarian syndrome. I was diagnosed with polycystic ovarian syndrome years ago, and my blood work is now saying I don't have polycystic ovarian syndrome. I was diagnosed with a blocked tube. My tube is clear. Everything is going good, but I'm not getting pregnant. But they say after you get the HSG that you're supposed to be fertile for up to 3 months. And so we're going to see what happens. So he checked my uterus. He said my uterus looked good. My ovaries look good. And he was like, you know, it's going to happen whenever it happens. Everything looks good. They also gave me a CD, which I'm going to show you guys. So I already got the CD in my laptop. They gave me a CD with my x-rays and things on it. Let me see if I can. This right here is just basically my name. And it says histosalpingogram, which is the HSG. I don't know why I can't get it to open. Okay, there we go. Now I'm on this screen, waiting for it to load up. And as you guys can see, this is an image of my uterus. I know you guys can't see that good, but here is when he was just putting the catheter in. You can see the catheter right there. And then here's the balloon right here when he first put it in. And there's the catheter. In this next picture here, you can see that he pulled the catheter all the way down right here to my cervix. I'm sorry that you guys can't really see. And here, you can see my ovaries really good. There's one ovary where my thumb is. And the other ovary is where my index finger is. And there's the catheter again. But anyway, yeah, so that's my uterus. I'm probably going to try to take pictures and probably do a slide eventually. But, oh, he got more pictures. I didn't even see that they had more pictures. I looked at the DVD yesterday. I had side effects the side effects that I had was spotting. I don't know if it was the iodine or actually blood coming out or blood from AF, because it looks like old blood, or it looked like it could be the iodine. So I'm not sure. Here's more pictures. I didn't know they had more pictures. I'm not going to go through explaining them. But yeah, that's, let me see, I didn't see. I guess this is my prescription that my doctor sent over here. But anyway, so I had a headache, I had spotting, and nauseated like crazy. But other than that, I'm feeling a little bit better today, and I just wanted to wish you guys good luck on your HSG. It's really not that bad. It didn't hurt at all. All the stuff you see online, the videos, they're really not that bad, but I guess it does actually differ from person to person. But you guys can ask me any questions, inbox me, or find me on Facebook, and I'll answer any questions you need. Later, guys.